Special guest, my husband here with me, Dr. Jafari in process.
Hello.
Okay, so today we're going to talk about one of the biggest deal in medicine and one of the biggest research that's going on medicine, and I'm sure all of you have heard about it, and unfortunately you might have a family member being affected by it, and we're going to talk about diabetes. Diabetes is divided into two groups. I'm going to let Kamyar talk to you about what are the two groups, and then we simplify it a little bit more.
So it's very simple. Basically, we have type 1 diabetes and type 2 diabetes. Now, what type 1 diabetes is it's an autoimmune disease. And what type 2 diabetes does is that it actually is an environmental component, meaning it's due to bad diet, it's due to lack of exercise, and it's due to obesity.
Exactly. So type 1, when he says it's autoimmune, it means your immune system, and I'm sure all of you know what immune system is, attacks our own body. And at this time, it's going to attack the cells that are responsible for making insulin.
Which are the beta cells of the pancreas.
Yes. So then it attacks those beta cells, and those beta cells can no longer make insulin. Insulin is the most important hormone that involves in regulating our blood sugar. Lack of insulin in body, it's going to cause body to not be able to absorb fat. People become really, really skinny. Insulin deficiency causes weight loss and severe metabolic problems. I'm sure all of you have heard about ketone diet and the mechanism behind that. And that's one of the way of making your body environment being an environment of lack of insulin. We'll talk about this diet later on in other videos. Whereas type 2 diabetes comes from the way that your body is making a lot of insulin. An individual can be eating donuts constantly or eating chips constantly.
That's a lot like me.
Or ice cream constantly. So then the beta cells are going to make a lot of insulin. Loads and loads and loads of insulin. Now the cells that are supposed to respond to this insulin, they become frustrated and they do not like to work hard as much anymore. So eventually they're going to say, hey dude, we're not going to respond to you anymore. You're making us work too hard. So then insulin goes up, but the body is now responding to insulin. Insulin is high in the body, so these individuals in type 2 diabetes are going to become big. They're going to be obese. Their BMI is going to be above 33, 34. So these people actually have high level of insulin initially in the disease. Compared to type 1 diabetes, they're going to have low insulin initially in the disease. And initially when you start treating those kind of people, you have to give them insulin. They don't have insulin and they need insulin for survival. So these are the two types of diabetes. Type 1, as Kamyar said, it's an autoimmune disease. There are millions different types of autoimmune disease.
One thing that should be mentioned is if you are, not you personally, but when someone has an autoimmune disease, they are more prone to other autoimmune diseases. For example, if someone does have type 1 diabetes, they would be more prone to getting something like pernicious anemia, Graves' disease,
B12, Hashimoto, which is lack of thyroid hormone,
or Graves, which is
MS.
Yeah, it's not MS.
Graves is like hyperthyroidism.
Hyperthyroidism, right?
Different types of autoimmune. So if you have one, or unfortunately if your mom, aunt, uncle, any family member has autoimmune disease and your genes are prone to autoimmune disease, then you're prone to getting type 1 diabetes. But you cannot say that type 1 diabetes is a genetic disease. It's just that the fact that your genes are prone to autoimmune diseases.
One interesting fact is that actually type 2 diabetes is the one that's more, that has the more genetic component than type 1 diabetes. Everyone thinks just because type 1 diabetes happens earlier, it should be probably a genetic factor, but it's not. It's actually type 2 diabetes that's more genetic.
Yeah, type 2 is really genetic. So if, for example, a family member in your family has been diagnosed with type 2 diabetes before age of 60, you should really pay attention to your diet. You should exercise regularly and pay attention to the amount of sugar you eat, because your cells are prone to being less responsive to insulin. So eventually they're going to give up faster than an individual who does not have the family history of diabetes. In later videos, we'll talk about more of how you can prevent these diseases, what kind of diets you can do, what kind of exercise you can do, and then also we'll talk about more about treatment, of how you can treat, because there are bad diseases. And let me tell you, type 1 unfortunately is a very bad disease, but the research is coming along with it to help a lot of individuals. Type 2 is a really bad disease as well. But if a patient is willing to take care of their own body and take care of themselves, they can stop type 2 and they can attack type 2 diabetes.
Basically, what she's getting at is if someone is exercising, having a better diet, eating less, losing weight is the most important thing they can do to treat their diabetes.
Now, if you guys have any questions or concern regarding diabetes, you can always leave a comment down below for us, and we'll love to discuss these questions and comments on the next videos. Have yourself a wonderful day.
We will be waiting to hear from you. Thank you.